Andrew Sellis.
Thank you very much, Mr. Davis, and it's a pleasure to speak in this debate, and I'd like to begin in the same way that my honourable friend did by introducing this debate, in saying that all of us here are here for mums as well. We're here very much for single mums. In fact, the last debate of this nature that I've spoken with the Minister was on maternal, perinatal mental health, and in fact it was a number of men leading that debate. So I think it goes without saying that all of us here are 100% behind mums and single mums, just as we are behind dads. But it is really because mums need support that this issue of involving fathers and helping them do their role in terms of equal parenting, a phrase I think is really important. I'm glad it's been introduced several times in this debate, is so important. And we know from the research that we are not getting this right at the moment, with 69% of fathers feeling like a spare part. And we know that fathers have the ability to offer round-the-clock support to new mums if they are supported and help to be involved, as the vast majority of them want to be. But there are some worrying figures about what's going on at the moment. If we look at income groups under £20,000, less than 31% of them are turning up to antenatal classes. If we look at income groups over £70,000, over 71% are turning up to antenatal. So we are not managing to reach really important groups of fathers who need that support. The inspection framework in this area doesn't look hard enough at what areas are doing to help fathers. Indeed, fathers are absent from a lot of the inspection frameworks. We know that if fathers are involved in the care of a young child, this is from government research in 2011, they are a third less likely to split up. When the Minister was before the Health Select Committee recently on the issue of suicide prevention, she told the Health Committee that debt and relationship breakdown were the two major causes of suicide. So, again, a really powerful reason for a number of important outcomes that we help fathers be involved with the care of their newborn children. So what I would say to the government is that it's excellent that in 2016 we set up a £39 million fund at the DWP to reduce parental conflict in workless families. That was an excellent initiative, which I really, really support. But what I would say to the Minister is that we need a second fund to improve the relationship quality for couples who are at risk at separation when they've had new children. And the evidence is there to support that. I think there is overwhelming need. It would be really helpful for mothers. And I would ask her to take it back to the department. I would ask her to take it back to the interministerial working group on the first 1,000 days that I know the Minister is on and fully engaged with, because I think that would be a really good development. I'd like to give a plug for a little programme called Let's Stick Together. This is, I'm not allowed at AIDS, I think, Mr. Davis, so I better not hold it up, but the course reading material could fit into a purse or wallet very, very easily. I've personally handed it to our last two Prime Ministers and encouraged them to try and take it up across government. But, some really simple tips when you've had a new child to help that relationship quality. And in particular, I'd like to commend the work of the charity called Dads to Be. Now, this charity, Minister, is active in a number of hospitals in South London. It focuses on antenatal work for groups of dads. It helps them, about the whole change to their lives, and it also focuses on improving relationship quality. So my question to the Minister is a very, very simple one, and I think this is my overriding plea to her. If we are doing this in some NHS hospitals, please can we do it everywhere throughout these islands across the whole of our United Kingdom? It is a no-brainer. It is sensible. Dads want it. We know there are better outcomes for mums and children if we do it. And I would also commend some quite simple changes. There's a health visiting team in Lincolnshire, for example, who managed to increase the participation rate of fathers in the primary birth visit from 20 to 70% by addressing their letter, rather than just as dear parent, they wrote dear new mum and dad. And that led to a 50% increase in the take-up of involving fathers from this health visiting team in Lincolnshire. Now, it's a really simple thing. It didn't cost any money, but it said very clearly to fathers, you know, we want you, you're important, you're welcome, we expect you to turn up, we want you to turn up, we're here to help. So there are some simple things to do that don't cost a lot of money. They just cost some political will. They're really needed, and I say to the Minister, please we should do them.